Hey everyone, sorry for the delay in starting. We on 24 changed their format, so we were struggling to figure out how to start the presentation. So apologies for that. It won't happen again since I don't expect they're going to change their format on us a couple days before we have a presentation again. So anyway, we are this month going to be talking about returning to work during COVID pandemic. I am fairly certain that this is the sort of topic that is probably impacting all of you on this call, on this webinar, and it impacts me on a daily basis as well. So there's a lot here. So let's jump into it. Okay, this is me, Kevin. That's when I used to wear a suit and tie. One thing we aren't going to talk about during this presentation is dress code. I think that's something that's probably going to, it's like there are bigger fish to fry than dress code perhaps right now with return to work issues, but I expect we're going to have some cultural shifts on dress code and expectations of dress wear and that sort of thing in a professional environment and professional office settings going forward in the future. So we're not going to talk about other than me just mentioning it right there, but prognosticating, I think we're going to start to see watering down of dress code expectations in the future. For those of you who are not on the MyHR Genius program, you are welcome to try it out. It's a monthly program, and it's really fantastic. All you can use calls and emails on any legal HR type of issue, and we have enhanced programs as well that include annual employee handbooks and 10% off legal services and lots of really awesome things. So if you're not on the program, I think most of you are on the program on this call, but if you're not, you are definitely welcome to reach out and find out about it. It's a very unique program. There's nothing like it in the country, certainly nothing that offers actual legal services. There's plenty of HR services out there, but not anything that actually offers legal services of the same degree. So we are going to talk about some workplace issues. We're going to talk about some reviews. We're going to talk about tips. What I really want to talk about is COVID and the impact on the workplace. We've got the FCRA. We're going to dive into that in a minute. But really what we also have are the old laws, so that we all know really well, as HR professionals, that we know and love very much. And so those old laws are very much in play. They just have, we just have different circumstances. So things like, ADA, FMLA, work comp, the interaction, we always talk about ADA, FMLA, work comp. It's like the Bermuda Triangle or the trifecta or whatever. Throw in PTO. Well, now we have the FCRA as well, but the interplay among all these is going to be really important for you as people start coming back to work. And certainly as people, a lot of your people probably are already back at work for depending on your state and your business and all that. But we are going to, see an increased issue until COVID goes away or this pandemic. And this, you can apply all this stuff to the next pandemic that we have too. So, you don't have to forget about it if this one's solved. Because these laws really do have application here, and we're going to talk about that. We're going to talk about a lot of workplace issues, common issues that I have been seeing, dealing on the front lines with COVID and return to work and everything since the beginning. There's just there's a lot of commonality, a lot of consistency in the issues because, people are consistent and they try to game the system, and they have the same common complaints around the country, probably around the world. And then we're going to talk about WARN, the WARN Act, because there is application to the WARN Act that you might not, I've been talking about it a little bit here and there on webinars and in our tips of the week. If you're on the MyHR Genius program, you're getting our tips of the week, and I've been talking about WARN there as well. But we need to, you as an HR person need a quick refresher on WARN, because it's something that you probably, if you've been doing this for a while, you probably really haven't had to remember what WARN is since 2008, 2009, when we were, doing lots and lots of layoffs over a long period of time versus the, massive amount of layoffs that a lot of companies did. Oh, furloughs, I should say, is the word du jour that the newspapers like to use, that I hate. Cannot stand the word furlough. So because it's inaccurate and it's inappropriate. Okay, so let's talk about workplace and COVID. Primer. I always mispronounce that word, but it is primer unless you're painting. So okay, so let's talk about Workplace 101. People like to complain, right? I don't think I'm surprising anybody in HR when I say that people like to complain. They think they have a lot of rights. People think they have like a right to free speech and everything like that. That's not really true in the workplace. You don't have a right to free speech. Your personal liberties, people like to have personal liberties. They are not as important as the employer's property rights. So take it for what it is, but property rights are like greater than personal liberties. I am sure if you've had employees returning to work, you have had complaints. You have had complaints about requirements, laws, ordinances that require that people wear masks. I know it's not every state. A lot of you are down in Texas and probably don't have to worry as much about masks in the workplace, at least laws around those, as we do like in Minnesota and in a lot of other states where there are mask requirements at work for employees. There are exceptions and limitations and all that sort of thing, but employees, people don't like to wear masks. I don't like to wear a mask. I'm not going to complain about it, and I'll follow the law because that's the type of person I am. But there are a lot of people, and a lot of those people are probably workers for you, that think that they don't need to wear masks, that they might have some sort of constitutional right not to wear a mask at work. Maybe they have a constitutional right not to wear a mask on public property. For the most part, those people are what we call wrong. You, as an employer, get to choose the rules. Nobody would question you if you said you are working around chemicals and in compliance with OSHA and industry standards that you need to wear PPE to protect yourself. Go put on the hazmat suit, right? Like nobody complains about that, and they don't say like I have a personal right not to wear this hazmat suit when I'm working around chemicals. That's a kind of a no-brainer, right? And you would say, okay, well, I have the employer's right to say that you're not qualified for your job and you are a safety risk, and therefore you are fired. It's the same thing with COVID. COVID is a safety risk. We have identified that there are safety issues and we are trying to, as employers, provide a safe work environment. So you have a property right. You have determined that you want to provide a safe work environment for employees, and if you require that they wear PPE or they wear a mask or they do other sorts of things, get their temperature checked, then employees, in order to access your property, they need to comply. Same with guests. Now, some ordinances, like Minnesota's got their executive order saying that you need to try to like accommodate people and that sort of thing. Okay, yes, you should probably try to accommodate people who are saying that maybe they have some disabilities and limitations and they can't wear the masks or the PPE. We'll get into that in a little bit. But for the most part, most of these people that are just complaining, they are just complaining because they don't like to wear masks and they don't like to follow rules and that sort of thing. So we don't need to change rules for them. We don't need to, and we could continue to say, nope, for safety reasons, we have set this policy, or we are complying with the law or the ordinance, and you need to wear a mask, and you need to follow our rules and get temperature checked and that sort of thing. Because, again, our property rights, we have a right to set the rules on our property. Masks and other procedural requirements, no different than safety rules. Kind of already talked about that a little bit. Employees don't have a right not to follow safety rules. Again, think of it with under OSHA with a big vat of chemicals. You would not. No employee, only a completely stupid employee would say, well, no, I'm just going to take my chances and go into that room and potentially be exposed to chemicals that could burn my skin. You as an employer are going to be like, I don't think so. And, even if the employee says that, because again, you have a safety interest. You also have like a work comp and insurance liability interest. You don't want employees to get hurt, right? Because you generally don't want to hurt employees, but then also because you have, more importantly, you have monetary insurance risk exposure if they do get hurt. One thing, again, my primer, I really have to think about this, not to mispronounce that word. One thing that I hear a lot is, especially from employees who are, of course, watching the news 24 hours a day, getting as much misinformation as they can. The CDC, it's guidelines. It's not the law. There is no real federal requirement with regard to COVID. Now, has OSHA come out and put out guidance? Yes, but OSHA hasn't changed. The OSHA law that we knew and loved 5 years ago is the same OSHA law that it is today. It's just being applied differently. OSHA came out, years ago when SARS-2 or something, whatever it's called. Anyway, when SARS came out and they put out some guidance, and again, it's just guidance interpreting OSHA. CDC is the same. If there are state and local laws that have been passed or ordinances, then those need to be followed. But at the federal level, there is, outside of OSHA that's always been around, there is no real new, there's no real new COVID law. Like, we have the FCRA, that's a paid time off law. But we don't have a new, safety requirement in the workplace, no federal requirement that you comply with CDC guidelines. And people say it all the time, oh, you have to follow the CDC guidelines. It's like, no, literally, it is guidelines. Like that. That's exactly what they are. They're guidelines to help you. Now, you might, it's probably fairly astute and bright to follow the guidelines, but you don't have to, because again, they're guidelines. And in some states and cities have legislated the guidelines, then you got to follow them, because, then the states could come in and fine you and arrest you and do that sort of thing. But at the federal level, we don't have anything that requires that we do, A, B, and C. Now, we're going to talk about the ADA and FMLA and FCRA and how they apply, but just, no CDC or guidelines. OSHA has specifically put out plenty of guidance. And if you go to the OSHA website, like I did, and if you see these little green slides on the right, these are literally all from OSHA. And they're not law. It's from the Department of Labor, I should say, Department of Labor OSHA division. They're not law. They are they're like little posters that the World Health Organization, again, not a federal agency, has put out, and OSHA's like, oh, here, employers, this will help you. We agree with this stuff, but that's very different than the law, and the reason is because OSHA has yet to find that COVID is what we call a safety hazard, right? Like that vat of chemicals in my imaginary workplace, that vat of chemicals, that is a known safety hazard. You tell somebody to go climb up that pole that's 50 feet high to install some wiring, that is a known safety hazard. OSHA says that you've got to do some things. You've got to put on PPE. You've got to put on safety harnesses, those sorts of things. COVID is not a safety hazard. And that doesn't mean you should ignore it and all that. That's not the point. The point is, that if somebody comes in and says, oh, it's an unsafe work environment, I can't work here because OSHA tells me that I don't have to work in an unsafe work environment, which is true. Like if an employer tells you to go climb that 50-foot pole without a safety harness, you as an employee can say, I'm not going to do that because that's a safety risk to me, and you can't, you shouldn't legally be then firing the employee because they've invoked OSHA rights. But that's not the same with COVID. COVID's not a safety hazard because you can pick up COVID anywhere, and it's not a safety hazard. We don't really know if it's in the workplace, right? I guess if you were like, a laboratory and literally you have a sample of COVID and you knew how to, yes, okay, then maybe you say like, okay, well, before like messing around with that COVID sample over there, you should you should put on some PPE. But just like COVID or the flu or the common cold or pneumonia, those are not, those are not safety hazards under OSHA. So as a result, if an employee says that they refuse to come into work because of a safety hazard, well, it's not covered by OSHA. Again, maybe state and local ordinances, you're gonna have to look at that. But at the federal level, we don't have to worry about that. Filing a work comp claim. Now, work comp claims are where we have worried. We've had conversations. If any of you have listened to my podcast, plug for my podcast, I guess, listen to the podcast. I did a great podcast with Kim in our Austin office early, like at the beginning of COVID, like in March. And, we talked about work comp and all that. We talked about OSHA, and really nothing's changed all that much. So the podcast is still pretty relevant, I believe. And if, under that, we talk about work comp. Well, I don't think under most work comp rules, again, every state's different, but under most states' work comp rules, if you get COVID, like, you're probably not going to have a viable claim that's going to be covered under work comp. Now, California has said, yes, if you pick up COVID and you return to people to work, then there's going to be a presumption that you picked it up at work. Illinois tried to do the same thing and had to back off of it. Minnesota passed an ordinance, the executive orders amending work comp for first responders. So in Minnesota, if you get COVID and you're a first responder, you could be covered by work comp. But most states, most situations, just picking up COVID, it's not good luck proving that it's directly related to work. I just think we're not going to see a lot of, unless the laws change, we're not going to see a lot of work comp coverage for COVID. Okay, continuing with my primers. I've already said this, no new federal laws except for the FCRA, and that's a PTO law, a paid time off law. I think I've already covered these things. It's a good thing that I put these slides together because then I foresee them when I'm not looking at them. One other thing just on my primer, you can do medical checks. I think most people have, a lot of companies have been doing that. You can do it for guests. You can do it for employees. You actually have more flexibility doing it for guests than employees. But what you can't do is medical exams. So for employees, there's windows of opportunity to do medical exams. But for the most part, we don't want to do medical exams. But you can do temperature checks. And you can do questionnaires, and a lot of employers are doing questionnaires. I recommend it. I think it's a good idea to do questionnaires, if only because I've seen a lot of situations where employees are lying on the questionnaires. I mean, look, you're trying to create a safe, OSHA or not, right? You're trying to create a safe work environment. And doing questionnaires is a nice risk avoidance, risk mitigation tool to get employees to think and rethink before they come into work with COVID-related symptoms. Or, if they've been exposed to COVID, and if they're trying to, come and pass it on to other coworkers, what you really don't want to do is have your entire workforce have to leave because they got COVID, right? So doing questionnaires is a really good idea. Also, we find that a lot of employees, not a lot, but employees are just, lying on the questionnaires. It's a good way to weed out employees who probably aren't smart enough to work for your organization anyway. And if they're lying on a questionnaire like that so that they can come into work and then expose everybody, then the next day they get tested for COVID, well, that's the sort of thing that, you might want to weed out, especially during a time when business might be slower. You can weed out some of the people that aren't smart enough to read a questionnaire and fill it out and consider their coworkers when they come into work. So, general rule, employers are responsible for the safety of employees on their property during working hours. Can you, I can't answer this, these good or bad ideas, but could you impose travel restrictions? Yes, I think a lot of employers for the first time ever imposed travel restrictions. Funny enough, so many of us were imposing travel restrictions on international travel. Well, now it's there's less of a chance of getting COVID internationally than in the United States. So yeah, that was a big deal. You don't want to go to Europe or China or whatever where you're going to get COVID. It's you're much more likely to get COVID probably sitting around at home in the United States. So travel restrictions, could you put travel restrictions on traveling to hotspots? Absolutely. Employees are getting stir crazy, right, around the United States. I don't think that's a surprise. I just came back from a nice vacation that I drove 3,000 miles to in Colorado, which is great, but I didn't fly, and I didn't go to, one of the hot spots, in the United States. So, can you do travel restrictions? Absolutely. Is it a good or bad idea? Really depends on your workforce. If you've got a professional workforce that needs to travel, that it's really important for business travel, then you probably don't want to put travel restrictions on. Could you put travel restrictions on non-essential travel, like outside business? Absolutely. You could say, hey, Thompson Co. could have said, hey, Kevin, don't go to Colorado. If you go to Colorado, you're going to have to isolate yourself for 2 weeks upon return. Absolutely. Thompson Co. could have said that. Thompson Co. can't stop me, right, or my employer can't stop me from going to Colorado. There's nobody's going to put handcuffs on me, right? But you can lay out what the consequences are if you engage in the restricted behavior. House parties, travel, all these sorts of things. Can you legislate or restrict your employees outside of work? No, but can you say if you do those things, there are going to be consequences, again, when you come to our property? Yes, absolutely. Now, maybe you don't care if somebody's teleworking, like that's not a big deal, but again, look at your property rights. Again, you can't tell me not to go to Colorado, right? Because what are you going to do? Like, you're going to call the police on me or something like that? That's not how, there's no laws that prohibit me from going to Colorado. But Thompson Co. can say there's going to be consequences for your behavior. You can't tell somebody not to drink, for example, much more common situation that we've seen over the years. You can't tell somebody don't drink alcohol outside of work. In a lot of states, there are lawful product laws, right? And so you could say, like, look, I don't want you to drink alcohol before a shift, but you can't force the person. You can lay out what the consequences are. The consequences are if you come to work inebriated, you're going to be fired, or you're going to be tested, or you're going to be suspended, or something like that. That's because you have a property right. And it's the same with COVID. You can set requirements around employees. But your stick in all of this is the consequence upon their return to work. Yes, okay. I think I've belabored that point. All right, let's talk about the FFCRA. I know a lot of you have been dealing with the FFCRA, but it's good to know because as people are returning to work, the FFCRA is still in effect and will be in effect through the end of the year. I expect that it will be extended into 2021. I don't know that, but I expect it will be. Okay, so what does the FFCRA do? There are two buckets, right? There's the 2-week bucket of up to 80 hours of paid sick leave, and then there's the 12-week bucket of 10 of those weeks being paid at 2/3 pay for if the employee can't come into work because of childcare being closed or school being closed. And even if schools are, so in the current situation, a lot of schools are going virtual, and that is still considered closure. If the kids can't go back to teachers in school learning, the virtual school is still considered closure by the Department of Labor. Employers with more than 500 employees aren't covered. And then some employers in the healthcare field are exempt. However, there was a recent federal case in New York that watered down that healthcare exemption, beating back the Department of Labor, who said, no, the healthcare exemption is pretty wide brush, and it includes like all these healthcare companies. And the federal judge in New York said, I don't think so. I think you're too broadly interpreting that. To be determined. So just know if you're a healthcare company and you're less than 500 employees and you've been denying FFCRA, just know there's like a potential schism here between what the Department of Labor has been telling us and what at least one federal judge has said. So I don't have any guidance for you other than to tell you, just be aware that your position might be undercut due to, federal legislation. When can an employee take this up to 2 weeks off of paid sick leave? Well, there are 5 criteria. I'm not going to go through all these. I think you've probably all, either listened to my webinars in the past, you can go watch my webinars in the past on this, or you've been dealing with it. But let me point out the one area that is pretty commonly misunderstood or abused by employees, and that is with regard to testing. And in order to be covered, if you look at number 3, in order to be covered by the FFCRA for paid leave, the employee needs to be experiencing symptoms of COVID-19. Okay? A lot of employees go to get tested because they've been exposed, or maybe because the employer even told them to go get tested, or maybe somehow they just got it in their head they're going to go get tested. FFCRA doesn't cover them and pay them for the time off work or reimburse you for the time off work if they weren't experiencing symptoms. Now, if the employee tells you, oh yeah, I do have a cough, okay, good enough. Write it down, experiencing symptoms, go and get your FFCRA reimbursement through payroll tax credits from the IRS. But they've got to be experiencing symptoms. If they're not, and they just go get it tested willy-nilly, or if you just say go get tested and they don't have symptoms, they technically aren't on FFCRA. And that's the other thing. Could you go and tell a non-exempt employee to go get tested under the for COVID and not pay them? Yes. You can go. You can let them use PTO or something, but you don't have to give them paid time off, just because even if they've potentially been exposed at work, there is no law that tells it that at least federal law that entitles an employee to paid time off to go get tested unless it's the FFCRA and they've got symptoms. With the FFCRA, with the paid time off portion, you cannot require that they use PTO first. If they're like one of those 5 areas, that were listed before, and if they go off work for one of those 5 areas, they get up to 2 weeks off. They don't have to use their PTO. You can't force them to use their PTO. Now, if it's one of the 3 areas that's paid at 2/3 and they want to use their PTO to bridge the additional third so they get full pay, sure, no problem. You can just let them use their PTO to bridge so they go from 2/3 to a full 3/3, and so they're getting 100% pay. But the law says that you can't force them. Now, I'll just say it now so I don't have to say it later. That is not the case for the FMLA portion for weeks 3 through 12. So if it's what I call the daddy daycare portion, where people can take up to 12 weeks off because of school being closed or daycare being closed, and weeks 3 through 12 are paid under this expanded FMLA, you can, just like normal FMLA, you can require the employee to take their PTO, even though the federal government says they're going to get paid 2/3. The good news for you is you can still get the credit for the 2/3. So it's actually kind of like getting reimbursed for the PTO that you've already promised to the employee. Win-win for you. So you can force the employee to use their PTO weeks 3 through 12, and you will still get the credit back on the 2/3 up to $200 a day for the time off. So that's like a total. That's a tip for you on saving some money during this situation. One other thing with the FMLA portion and the paid time off is there are limitations. You really cannot require a lot of documentation on this. Can you ask for it? Yes. Can you require it? No. You can ask for certain information from the employee, and that information is listed on here. Some of it's applicable, some of it's not. But you cannot require that an employee bring you in documentation. Now, states are all giving, like most states anyway that I'm familiar with, they're giving out written documents if people are being tested. And they're giving, most states now are giving out sort of documentation, especially if they're being tested positive. And you could ask for it, but again, you cannot require it. At least you cannot require it for payment condition under the FFCRA. Now, if this is an FMLA situation, like say they've exhausted, like they got COVID and the 2 weeks is gone, and they need another 4 weeks or 6 weeks because COVID is just really running them down, can you require medical documentation for that under the normal FMLA or, even not under the FMLA, just like the ADA? Yes, absolutely. But you cannot condition payment under the FFCRA on their bringing in a bunch of this documentation. But you can ask for certain information like the name, dates and medical provider who told them they had COVID or and that sort of thing, like where they got tested, that sort of thing. Also, intermittent leave. You cannot give intermittent leave to somebody on the paid sick leave, the 2-week portion. You can't give them intermittent leave if they're coming into work. If they're teleworking, yes, you can voluntarily, it's up to you if you want to give them intermittent leave. But if they're coming into work, no intermittent leave. They have to take the full day off because basically we don't want people coming into work intermittently with COVID. So just kind of, otherwise intermittent leave is otherwise voluntarily up to you. Okay, I'm going to read, let me see if any of these I have not covered. Okay, what if the employee doesn't want to work because they are afraid of COVID? Tough luck. That's the legal doctrine of tough luck that I've just, identified. If they have an ADA, underlying disability, we'll talk about that in a minute. But if they are just afraid, whatever reason they're afraid, they don't want to come into work, do they have the right to stay away from work? Not under federal law. I'm not familiar with states where they have the right to not come into work. If you're requiring it and if you're complying with state rules and that sort of thing, if they are expected to come into work and if that's legal under the state laws and ordinances and all that sort of thing, then their fear is it's not protected. It's not protected under ADA, it's not protected under FFCRA, it's not protected under FMLA, work comp, any sort of thing. So would it have to be paid? No. You could just say, well, fine, don't come into work. You're on an unpaid leave of absence. You could also say, no, I need you, and you are going to be fired if you don't come into work. You can do that too. You have a lot of flexibility in that. What if the employee uses the 2 weeks of the paid sick leave to care for someone with COVID, then gets COVID themselves? Do they get another 2 weeks? And the answer is no. It's 2 weeks flat. It doesn't matter how they use it. They get up to 2 weeks in 2020 and no more. Same with the FMLA. You only get 12 weeks of FMLA, whether it's like normal FMLA, or pregnancy leave and bonding and, typical serious health conditions and chronic conditions, the good old FMLA that we've all known and loved. You get 12 weeks aggregate with that and the paid FMLA that I'm going to talk about in a second. So yeah, no more than 12 weeks of FMLA under any circumstances except for like military leave, which sometimes you can get up to 26 weeks. Totally different webinar. What if, and I've heard this a lot, what if the employee took their sweet time to get tested, then 5 days passed, which is kind of like typical waiting time these days, unfortunately, for test results in a lot of cases, states. And then 5 days passed, and they got the results, and basically they milked their full 2 weeks. How do you handle it? Well, first of all, you could ask about the details with the testing. If the employee left work, let's just say today is Thursday, right? So they left work Thursday, and they're like, oh yeah, I got to go get tested. And then they don't get tested till they don't come into work Friday, and they don't get tested till Saturday. and then they don't get their results. Well, there's no reason for them to be off work unless there's a reason that they couldn't get tested until Saturday, like maybe the tests weren't available or whatever. But if they just basically took the opportunity to have a long weekend, you don't need to pay them, and you could call it an unexcused absence. But if somebody takes off work, they go get tested, and then they have to wait 5 days, and then let's just say it's 5 days, and they find out next Thursday, hey, I'm clear, you can fully expect them to come into work that day or at least the next day. And they don't get paid, and it's unexcused. It could definitely be unexcused absence after that. Once they get tested and they get their results, there is an expectation that they come into work. Just because it's a 2-week law, that doesn't mean that the people get to milk the full 2 weeks 2 weeks off. I've already talked about what if employees lie on the questionnaire. I've already talked about what happens if employees get exposed and intermittent leave. Are employees eligible for unemployment benefits while on the FFCRA? No, they're not. You might have had some employees who have asked to be laid off so that they could go on the sweet unemployment benefits. I suspect that's not happening a lot so much now that the federal government's done away with, let expire the extra $600 benefit. But can you get FFCRA at the same time as unemployment? No, you get one or the other, not both. Another question you might have come up this fall: what if the employee didn't use the FFCRA to care for school-aged children in the spring? They were fine, they didn't have to use it, but now they want to use it in the fall because the kids are virtual learning and they want to be home to take care of the kids. Can they get FFCRA, up to 12 weeks? Yes, they can, at 2/3 pay. So just because they didn't use it in the spring doesn't mean they're precluded from using it in the fall as well. There's not a lot left to talk about with the FMLA other than what I've talked about already. The only thing I would mention on the FMLA portion, which is the daddy daycare or school daycare being closed that I just mentioned, is, again, you can allow for intermittent use. It's up to you as an employer if you want to use it. It does run concurrent with normal FMLA. So again, aggregate 12 weeks between the normal FMLA that we've known and loved and this paid FMLA. That's the only, those are kind of the main things. And then the other thing is that unlike normal FMLA, this paid FMLA does cover any employee who's been with you at least 30 days versus 1 year, which is the typical FMLA. So 30 days of employee, after 30 days, they're eligible for this paid FMLA portion. Okay, so let's talk about the application of COVID with regard to ADA, FMLA, work comp, OSHA, FFCRA. Okay, so I want to do this. So these are all the laws, and this is, FMLA is a paid time off law. Work comp is work comp injuries. So we need to know how this all mixes up. So I came up with some scenarios. So let's look at the scenarios and then talk about the application. So the employee says they can't work in the office because they're high risk. How do you approach it? Okay. So if an employee just says that they're high risk or they live at home with somebody who's high risk, if the employee says they're high risk, I would ask the employee, just like an employee who says they can't do something and they allude to the fact that they might have a disability, the ADA is going to be in play, as is the FMLA. So I think you want to explore with them. FFCRA is not in play because high risk is not going to be one of the 5 factors, and it's not daddy daycare, so we don't have to worry about that in the expanded FMLA. But if they're high risk, I think it behooves you to ask, okay, well, could you explain to me, do your disability questionnaire form that you probably have, or your FMLA medical certification form. Find out what makes them high risk. And if it's because of an underlying disability, then in that situation, we want to engage in the interactive process, the good old interactive process, to understand if we can accommodate them with time off, if that's a reasonable accommodation given the circumstances. Maybe it is, maybe it isn't. It's going to be up to you. to determine based on your circumstances, but that's the approach that we want to have. If somebody says high risk, that to me, it triggers the potential that there's a disability. Now, if it's a family member who's high risk, like a spouse, and they don't want to come into work because they're concerned about the spouse getting COVID, well, ADA doesn't cover other people, right? It only covers employees. So we don't have to worry about the accommodation side of it, but we could still understand if there's an FMLA component there. Probably not. Because again, FMLA is a time off, and the employee probably might not need the time off for an FMLA. But FMLA would then be potentially in play, and we would want to inquire about it. We don't have to worry about work comp. We don't have to worry about OSHA because, again, OSHA, unless very, very limited circumstances, OSHA is really not going to give the person a right to say that they don't want to come into work. You have a mask requirement policy. Maybe it's legally required, maybe it's not, but you have it. And the employee refuses to wear it, saying that she has asthma, and it restricts breathing. I've seen a lot of these, right? A lot of people that suddenly have asthma because they don't want to wear masks. Maybe it's legitimate, maybe it's not. Let's find out. So I would ask the employee to support the claim that they have asthma. Here again, asthma is a disability under the ADA in pretty much all circumstances. And so you would want to inquire to get an understanding of the underlying medical condition, what the restrictions are, and if the doctor says you can't wear a mask, okay, can you wear a face shield? I certainly wouldn't want to walk around the office in a face shield, but hey, I guess, that'd be better than nothing. And if their employer requires it, they require it. But a face shield might allow you to breathe better. And so you would, again, this is part of the reasonable accommodation, the interactive process. We don't want to just knee-jerk reaction, tell the employee, sorry, mask or no, you're out. Now, if the employee says, no, there's no way to accommodate me, I need to be off work, and yeah, I do have asthma or some sort of condition, it's just so bad, but I can't come in, then you have to make a determination. Can you indefinitely, basically, because we don't know when COVID is going to be solved. If you do know when COVID is going to be solved, let me know. I'd like to know that. And as a result, you are in a situation where it's an indefinite leave of absence request. And the ADA is pretty clear that indefinite leave of absences are, pretty much unreasonable for an employer. And so you can then say, well, we can't promise that we're going to be able to hold the job for you. And so, come back when you're able to work, maybe when COVID's solved and there's a vaccine or whatever. Come back when you're ready, and hopefully we have a job opening for you. It's a nice way of terminating the employee. But just know that because we don't know how long COVID's going to last, if somebody can't come into work, you really don't know when they're going to be able to come back, and it's probably patently unreasonable for you to continue to accommodate them with an unpaid leave of absence. Again, here's my approach. Identify whether the employee has an underlying disability by asking about documentation to support the disability. If it's an ADA situation, determine whether it's a chronic condition or a serious medical condition for FMLA, because it could be that in that situation, then FMLA might trigger, normal FMLA for employees that have been, working for you for over a year, and FMLA might trigger, and so it might give them some time off work. If COVID's related to those 6 circumstances covered by the FCRA, then again, it might trigger some paid time off. Look at your own PTO policies as well to see if, or short-term disability policies. And again, short-term disability is normally like an insurance policy. It's not necessarily a guarantee that you hold the job open for somebody. Same like work comp. Work comp's a compensation law. It is an insurance, insurance law. It is not a hold the job open law. The only law that holds the job open for employees, well, FFCRA does. While somebody's on FFCRA, it entitles them to return to work. But otherwise, only the FMLA holds the job, and USERA for military leave hold the job open for employees while they are off work. Okay. I know I've gotten questions, but I also am mindful that I only have like 10 minutes left. So a lot of your questions, I am seeing them. They look fantastic. And if I can't get to them here in the next 10 minutes, I will I will definitely send responses on email. Okay, let's talk about WARN. I definitely want to talk about WARN because I think a lot of companies are not thinking about WARN. Like we all did the, again, I hate the word furlough, but people call it furlough, so I guess I'm just going to call it furlough. But they did the whole like furlough thing back in the spring, and a lot of companies are bringing people back. Now, do I think a lot of employees are going to be terminated? Absolutely. You've probably been weeding out, even if you've been bringing people back, you've probably been weeding out poor performing employees or unproductive employees, however it is. And so there's probably a combination of layoffs and terminations and furloughs and all that. Okay, so here's what you need to know for the WARN Act. The employers with 100 or more employees, so if you're a smaller employer, no worries, don't worry about it. But if you do a plant closing, you probably aren't doing a whole lot of plant closings. It's probably a lot of layoffs. And I'm just going to say this, because I hate the word furlough, I'm just going to use the word layoff, and because that's the more accurate word. So I'm going to call it layoffs, but you might call it furloughs, and that's fine, totally fine, tomato. But I'm going to call it layoffs. So if it's a plant closing, you're closing and you affect 50 or more employees, then in that situation, you might trigger the WARN Act. And that means that what the WARN Act requires is that if you're going to close a plant that affects 50 or more employees, or if you're going to lay off, furlough is the same as layoff, lay off 50 or more employees, and the 50 or more is at least a third of the workforce at that site, then the employees are entitled to 60 days notice. Now, fortunately, almost 30 years ago that the WARN Act was passed, Congress Congress apparently worked better back then and wrote better laws. Congress said, oh, yeah, but if there's an unforeseeable business circumstance, then you don't have to give the 60 days notice. You just need to give as much notice as you practically can. I am pretty sure that COVID, coming out of the blue like it did, is an unforeseeable business circumstance. Now, does that give you carte blanche to not give notice to your employees? I don't think so. And here's where it gets tricky. Layoffs or furloughs that last more than 6 months are terminations under the WARN Act. So now, let's just play it out. Let's just say you're a restaurant, and you laid off, and you have, at that site, you have 75 employees, and you laid off 60 of them. Okay, so we're over 50. We're over a third. Even my bad math is over. That's well over a third, and you laid them off in March, April 1st. Let's just call it April 1st. You laid them off April 1st. Okay, 6 months goes by, right? So we've got May 1st, June 1st, July 1st, August 1st, September 1st, October 1st. October 1st comes around, and you'd like to bring back the people, but you just can't because, hey, restaurants, people aren't going to restaurants as much anymore. So you haven't. So you still have 60 people that you laid off. You want to bring them back, but on April 1st you laid them off, and come October 1st, 6 months is up. Boom, that triggers WARN. That's 50 or more employees, retroactive to when you laid them off. And guess what? You didn't give them 60 days notice, right? Okay, now I think you're going to get a pass. California doesn't have this provision, but I think you're going to get a pass because it was unforeseeable on April 1st that the employees were going to be that COVID was going to hit and close down your business. I think you're going to be okay. But we now know a lot more about COVID. So if you're doing layoffs these days, we have to look over a 90-day aggregate period. And if over any 90-day aggregate period you have 50 or more terminations and again, a layoff of more than 6 months is a termination. You look at the first day that they were laid off or terminated, and you add all these people up, and if over any 90-day period you have 50 or more employees, and it's like a third or more of the workforce at that site, or if it's a plant closing, it's 50 or more and the plant closed, then you owe those people 60 days notice. Now, again, you could argue business circumstances, you didn't foresee it, but if you did foresee it and you could have at least given them 2 weeks notice or 30 days notice or 10 days notice, you should have. And we can't hide behind, in March and April and even May maybe, we could have hid behind the whole business exception and said that we couldn't provide 60 days notice. But now we have better information. Now we are starting to plan and strategize. And so if you're planning and strategizing, that means that you could give notice, and now it behooves you to give some notice. And I'm not saying you have to give 60 days notice to everybody, but I am saying that you need to be very mindful of the mix of layoffs, furloughs, and terminations to make sure that you're not triggering these warrant obligations, because you could be looking at a lawsuit or a Department of Labor action trying to come in and collect 60 days worth of pay for these employees that did not receive 60 days of notice. And if this all sounds complicated, it is complicated. And so it's really like I do entire webinars on just WARN Act. So call, and hopefully you're on the My HR Genius program, and you can call and you don't have to worry about a legal fee for calling me. But there are a lot of nuances. This is a very long-standing, complicated law. But I would just be very mindful of your layoffs, of your terminations, and what you're doing with regard to those to make sure that you're not triggering WARN as much as you can. Okay, and I definitely won't be able to get to the questions, so apologies for that. But I am at the end of the presentation, so I at least was able to rocket through the presentation with in the 55 minutes that we had. Have a plan. You're bringing people back. You definitely want to, again, even if OSHA doesn't cover it, you want to comply with ordinances. You want to comply with states. You want to have a preparedness plan. Employees, if they're coming back to the office, a lot of them are going to be nervous. They're going to be scared. They're probably going to be excited to come back as well. You want to have a plan and communicate that plan to them, that you have safety precautions in place and you're doing what you can as an employer. And it might not be perfect and you can't make it 100% safe, but that's just life. You don't need to make it 100% safe for them, but you should do the best you can so that employees feel comfortable and safe coming back to the office. Have a communication plan. When COVID hits, you are likely going to have COVID occur. Definitely don't give employees names who get COVID. If the employee says, yeah, you can communicate, that I have COVID, then that's fine. But we have to be mindful of the ADA, that COVID's potentially a disability. We have to be mindful of HIPAA as well, that we don't want to give out names and all that and disclose private, PHI of people. So have a communication plan. Tell employees what you want to do. Maybe you're going to close down the place for cleaning. Maybe you're just going to say, hey, this department, there was an exposure. You should all be watching your symptoms for the next 5 days. If you need to go get tested, go get tested. PTO is available, that sort of thing. Have a communication plan in place because you are almost certainly going to have to use it. Have a strategy for addressing when employees do get exposed, what your strategy is for returning them to work. Have that in place beforehand or at least early on. Be careful about firing employees who complain about safety. Even if OSHA doesn't cover this, even if work comp doesn't cover this, we still don't want to generally retaliate against employees because we still could get a retaliation case or allegation, even if the laws themselves, even if it's not based on a whole lot. And then also, if employees are expressing that they're high risk, that they've got underlying medical conditions, we don't want to knee-jerk tell them get in the office or you're fired, or just, we want to engage in this conversation like we would under the ADA, maybe under the FMLA, try to get some information so that we have an understanding of what the underlying medical condition is, so that we can engage in this conversation to see if we can potentially accommodate them, if that's reasonable for us, or if it would be an undue hardship. So definitely, we definitely want to engage in that conversation with employees. Okay, thank you. Again, apologies for the delayed start, but we still got 55 minutes in, which is great. Next webinar is on Harassment Investigations 101. Always exciting topic. We're going to go over harassment investigations. If you have any questions, in addition to the ones that I got, I really appreciate it. I will respond to people. And if you have any questions, definitely reach out to me at kmosher@thompsonco.com or at 651-389-5000. Take care, and I'll talk to you next month.